Welcome to our discussion of the reproductive system. This portion of this course is necessarily going to be a little bit longer than its counterparts of gastrointestinal and endocrine because we're going to have to discuss organs that are specific to the two different sexes. And we're going to have a whole discussion on the difference between the terms gender and sex in a subsequent PowerPoint. But before we get started, I just wanted to point out that even though the terms sex and gender are not necessarily binary, we will be discussing the typical reproductive anatomy system of a male and a female in this particular course. Alright, so I just want to give an overview really quickly of what we're going to discuss. And we're going to discuss both female and male genital organs, both internal as well as external. A lot of times when you hear the terms for external genital organs, you hear genitalia. So we'll have discussions of both female and male. Also, in terms of female, we'll discuss the specifics in terms of the reproductive cycle. Now, as we continue our discussion, we're going to talk about the pelvic cavity and what it is. What makes up the pelvic cavity in terms of the muscles and the ligaments that are really important in terms of the protection of the organs. We'll continue with the discussion of the perineum. And in terms of where the boundaries are for the perineum, these can differ wildly depending on which source you're talking about. So we'll talk about the most up-to-date categorizations as we go. Lastly, we'll talk about the neurovasculature and lymphatics and the development of the reproductive system. But before we move on, I really want to talk about some terms that are going to come up over and over again. And we want to kind of get these out of the way so the rest of the PowerPoints and the discussions will make sense. So first is the term gonads. Gonads are another word for gametes, or they're going to produce gametes, which are your haploid cells. And so when we're talking about gonads for the female, we're talking about the ovaries. And when we're talking about gonads for the males, we're talking about the testes. So we'll talk about these in more specifics individually as we move on. Both male and female reproductive anatomy include a system of ducts. This is particularly more frequent when we're talking about the male anatomy. Accessory sex glands, these are going to secrete fluids that will play a role in terms of the protection of the gametes or the fertilized ovum, as well as lubrication, which is important as well. And lastly, supporting structures. Specifically, we're going to talk about the muscles and ligaments that play a role in terms of the pelvic cavity and the perineum. And lastly, it's really important to talk about the medical disciplines that are really focused in these areas. When we're talking about gynecology, this is in terms of the female reproductive system, so these are physicians that are specialized in that type of medicine. And a lot of times you'll hear the term OBGYN, which is kind of a combo of gynecology and obstetrics. Obstetrics is specific to pregnancy as well as delivery and then postpartum. So a lot of times physicians will be trained in both gynecology and obstetrics. Urology is going to be the study of the urinary system. We're not going to discuss all the specifics of the urinary system. That's discussed in another part of the course. However, when we're talking about the male reproductive system, these are very much intertwined, and oftentimes if you have some type of disorder with the urinary system, it will also affect the reproductive system of males. So there'll really be physicians that are trained in terms of both. So we're going to continue the discussion of each one of these individual organs that we talked about, but before we move on to that, let's talk about the terms sex and gender.